Have you been told you have non-specific lower back pain? Well, this is the tutorial that you want to watch, listen to, and learn from, because there is no such thing as non-specific lower back pain. And hopefully what I'm going to do is dispel some of the myths around it and help you understand a little bit more about back pain and potentially the back pain that you have, because this comes about from, a lot of people talk about non-specific lower back pain, but particularly I was sort of trudging through social media as one does sometimes, and I came across an osteopath. It was on Instagram, and he had a few sort of videos of him talking about or demonstrating some exercises and stretches and this, that, and the other. Then I went into his description, and I've got it here on my phone. And a part of it, I don't need to go through the whole thing, but generally speaking, the majority of back pain is non-specific, which means there is not a detectable or blamable tissue, muscle, ligament, etc. that we can say is the cause of pain. Now, non-specific lower back pain doesn't exist. There's no such thing as it. So in some respects, that is a completely false statement. But at his current level of knowledge on it, he believes he's telling the truth. Now, he's an osteopath, so he does have a level of knowledge. He'll have a level of knowledge of anatomy. He'll have a level of knowledge of the service that he's providing. And, in that respect, he's got a knowledge base. But when it comes to lower back pain, if he's using non-specific lower back pain as a term and a way of diagnosing back pain, then unfortunately it's incorrect. I've had the pleasure of interviewing Dr. Stuart McGill. I've got his books back there, so you can see low back disorder. I've then got the next 3 books next to it are his other 3 books: Back Mechanic, Gift of Injury, and Ultimate Back Fitness and Performance. I've also attended his 3-level workshop, so his foundation level 1, his assessing level 2, and his performance level 3. So I have an understanding of the work that he provides. But in the first interview that I did, I asked him about non-specific lower back pain. I asked him what his thoughts were on it. And sort of paraphrasing, he said that there is no such thing as non-specific lower back pain. What hasn't been done is an adequate consultation and assessment of that person's back. Because what you can find if you do an adequate consultation and assessment, you can start to find tissues. You can start to find, what else did he say? You can start to find tissues, muscles, potentially ligaments that are causing pain. You can certainly find movements, postures, positions, and loads that trigger pain. And if you can find those, you can start to find the cause of the problem. What it will also do is certain questions that are asked in the consultation and certain tests that are performed in the assessment will start to point towards certain tissues of the lower back, be it the vertebra, the facet joints, could be the disc, could be the nerve, could be muscles in and around the lower back. So we've got all of these different tissues that we're able to start to identify and sort of hone in on, converge in on the cause of the problem. Just by answering one question isn't going to say you've got X lower back pain or you've got Y lower back pain. There's an investigation process to it. There's a process of understanding to it, and then what you will tend to find is it is highly likely that it is this part of your lower back causing your pain, or it is highly likely that this movement or posture is triggering your pain, and then we can go about putting in the proper steps. So what we can find is that there is a specific cause to the lower back pain. It could be the flexed posture, it could be the extended posture, it could be compression of the spine, it could be loading of the spine. So there are all these different things that can be identified. Obviously, as I've mentioned, there are questions in the consultation, and these questions are the ones that I ask people on my online coaching and my face-to-face coaching. So I've, in some respects, taken his consultation and assessment. In some ways, I've added bits to it, and in some ways, I've taken bits away because it doesn't necessarily the consultation doesn't always flow in that direction, if that makes sense. So there are bits that I've added, bits that I've taken away, but largely, and I mean largely, it's the consultation that he recommends. It's also the tests that he recommends. If you go to low back disorder there and back mechanic, the tests are in there. So I've taken the tests from there, I've put it into my assessment. It's obviously then explains everything about, right, if they have pain during this test, then it's pointing towards this tissue, it's pointing towards this movement, and it's pointing towards this type of lower back pain. So you can start to build a picture of the lower back pain. So if you do the adequate consultation and assessment, you start to find specific aspects of someone's lower back pain. So just throwing a broad term of you have non-specific lower back pain isn't helpful to anyone, because if you throw out the term non-specific lower back pain, you can't go about then treating it because you don't know what you're treating. You can only treat and rehabilitate specific things. If you're just throwing out exercises or stretches, then the back, or you could possibly be missing a lot of the problems in the lower back pain. And there was another bit in the little description that he had. But because of this, and because our backs are actually very robust and adaptable, what we find is that the sooner we get used to and better at moving around, the easier we heal. Now, so what he's suggesting there, now it was a 4 sort of video series. He had different exercises, different stretches about lower back pain. Now, he's just throwing out there, you've got non-specific lower back pain, so we don't know what it is. We don't know what the problem is. And what we're then going to do is just give you some very broad and not very helpful information in that as long as we get better at moving, then it's going to easier heal. So if someone lifted a box from the floor and that triggered their pain, if we just tell them to continue lifting or continue moving or, a different type of lifting or whatever, then he's expecting it to heal. Now, that's not necessarily the problem, because as I've mentioned, if they do a movement that is the trigger of their pain, but that hasn't been identified because they haven't done an adequate consultation and assessment, then they're doing the thing that causes the very problem that they have, which isn't helping and healing their lower back pain, because they keep compounding the problem by continuing to do it through the movement that they do. And if I had the time in this tutorial to go through the different exercises and the different stretches that he was recommending, again, I could sort of talk more about that. Essentially, he was saying stretch your hamstring, stretch your lower back, which isn't a sensible thing to do with lower back pain. Again, I've asked Dr. McGill that, and he said they're pretty redundant things and they can make your back pain more sensitive to pain. So again, it creates the very problem that you're trying to solve. So it's very much thinking about, to sort of bring this full circle and hopefully summarise, there is no such thing as non-specific low back pain. That's number one. If someone is telling you you have non-specific lower back pain, what they're saying is they don't know the problem, and they don't know the questions to ask in a consultation, and they don't know the way to assess a lower back in an assessment and sort of test process to be able to determine what movements, postures, positions, loads, or what tissues are being damaged or triggered during those movements, postures, positions, and loads. If you want to get to know the specific nature of your lower back pain, which you will have in some way, shape or form, there is a consultation out there. I have it available online. You can go through it on my online course, which is a self-guided one. You can get in contact with me and we can go through it remotely online. So we can do it via Zoom, phone, wherever you are in the world, we can do something. Same with the assessment. The assessment is online. Again, it's self-guided. You can go through it. There are sort of explainer in how to interpret what each test means. Again, we can do that online if you want to go through the test and then send me the results, and then I can interpret it for you. And we can do, there's a million and one ways that we can go about helping you explain and understand your lower back pain, so you kind of have a better idea of the specific nature of it. If you have an idea of the specific nature of it, you can then go about putting in a specific and tailored rehabilitation program for it. So if you've been told you have non-specific lower back pain, don't lose hope. There is hope out there. You just need to get to know, understand your lower back pain a little bit better, so you can start tailoring the rehabilitation with some specific information from questions and assessments. So hopefully that's given you a better idea of non-specific lower back pain, and maybe a part of the industry that I work in regard to, you know, what to maybe listen out for and look for in what is, you know, when someone's helping you understand your lower back pain. So many thanks for watching. My name is Chris from Christopher Holt Training. I'll speak to you in the next tutorial.